Hello, my name is Dr. Greg Muller. I'm a licensed psychologist and assistant professor at the University of Texas at Austin, United States. And in this video, I'm going to walk you through how to give exposure therapy psychoeducation to your patients and to begin that treatment process. Beginning this conversation, I always go back to the example of a 7-year-old patient that I had worked with previously. She came into my office and said, "Hey, Dr. Greg, so here's the deal. You just need to make me never scared ever again." And what I said to her was, I would never want to do that to you. The girl was obviously surprised. I was the person that she was coming to get relieved from her symptoms. But what I talked to her about is that emotion is really important. Emotions like fear, even though they're unpleasant, allow us to survive and move towards our goals. Happiness tells us if we're being successful. Anger tells us that perhaps somebody is mistreating us and we need to do something to change that. Sadness, maybe we need to fix a relationship that we have with somebody or reconsider our goals. And fear tells us if we might be in immediate danger and maybe we need to take some action to keep ourselves safe. And within exposure therapy, there's an extremely important question, which is, how do I develop a healthy relationship with fear? Not the elimination of fear, because if people were never afraid, they would do extreme things like walking into traffic where there's cars or petting tigers. And so this question of how do I have a healthy relationship with fear helps patients realize that it's not about removing their fear, but making peace with it so that they can use it to make decisions that will best help them move towards their goals. And so explaining exposure therapy, I often use this model to begin the conversation. So as you'll see on the y-axis, there's an A, and on the x-axis, there's a T. That stands for time and anxiety. And not just anxiety, but you can also think of it as fear or distress as well. And we think about this fear, distress, or anxiety from a 1 to 10 scale. 1 might be something that is somewhat fear producing, but not too bad. So studying for a test. Whereas a 10 out of 10 would be something extreme, like a tiger coming after you, where you're in immediate danger. And our body is very smart, and we have this system for a reason. When we encounter danger in our life or things that might be dangerous, our body goes into a fight, flight, or freeze mode to get us into action. And so let's say a tiger bursts into the room right now. Hopefully you would have a stress response, and you would either fight off the tiger and punch it in the face, or run away fast and get to safety, or freeze and pretend to be dead and the tiger won't eat you. And when you get to safety, this system kept you alive and it worked really well. But what we see happen is that in a series of conditions like obsessive compulsive disorder or post-traumatic stress disorder, other anxiety conditions as well, this healthy system gets taken over and we begin to see a new pattern, a pattern that's based on avoidance, escape, or accommodation of our fears. So in this example, I would encourage you to think about the case of a soldier who has combat experience. Perhaps they've been in serious situations and they've gone on to develop trauma-related symptoms like nightmares or flashbacks. They feel poorly about themselves, and they generally avoid reminders of the fighting that they've been a part of. And so eventually they come home and they still are experiencing these situations after some time. And even though they're back home and hopefully away from danger, they often encounter reminders of the events that they experienced before. So an example that we might think of is a car backfiring or a car making a lot of noises. This can sound very similar to gunfire or other explosions that the soldier maybe experienced while in combat. And these reminders, even though they're not truly dangerous, trigger that stress response, that fight, flight, freeze response that would usually keep us alive and safe from real dangers. And so what we see happen is that that soldier comes home, they are around these trauma cues, these trauma reminders, like a car going off, and they have a stress response. But what we see here is that pattern of avoidance, escape, and accommodation comes into play. And so instead of staying near those reminders and practicing becoming used to them, we avoid. So this soldier hears a car backfire and they become very anxious or stressed and they move away. They say, I can't be near this reminder. It's too much. It's too overwhelming. And so they avoid. And the ironic part of this is that pattern of avoidance actually makes them feel better for a while. It very quickly lowers their anxiety. But what we see here is that their anxiety does not come back to zero. Their anxiety remains slightly higher than it would normally be if they had stayed around that reminder. So the next time that they encounter a reminder, let's say they go out a month later and they hear a car backfiring or they hear a loud noise, they avoid again. That avoidance temporarily lowers their anxiety, but not down to zero. And what happens is that over time, this pattern of avoidance continues. The person's anxiety continues to grow. And over time, this reminder of their combat experience, something that's not truly dangerous, like a car backfiring, reminds them and feels as bad as their experiences in combat. It produces as much as anxiety, these reminders. And so there's a question here of how do we disrupt this cycle? How do we give people a new opportunity to interact with their fears? And that's through exposure therapy. Exposure therapy allows you to approach the things that you are afraid of. Exposure therapy helps block the avoidance behaviors that people would typically use to try and make themselves feel better. So what does this look like? This, with the assistance of a therapist, this would, and also with the patient's agreement, you would move the patient towards these reminders. So perhaps this would be going out into the community where there's cars, listening to loud noises, listening to cars backfiring. This is going to produce a lot of anxiety in the short term. The patient's going to have a stress response. But what we find is that that stress response doesn't last forever. Eventually, the patient's body is going to start to relax. They're going to start habituating to this trauma trigger. The stress will not last forever. And so then at a later date, you take the patient back to that same situation where the cars are making loud noises, the cars are backfiring, it reminds a person of gunshots, and they habituate, their anxiety drops after a certain amount of time. And you repeat it over and over into the future. And what the patient begins to realize is that their anxiety doesn't go as high. It also comes back down a lot quicker. And they start to learn that this thing is not truly dangerous. This reminder is not truly dangerous. And their body no longer goes into that fight, flight, or freeze process in the same way. Now, sometimes we do exposure therapy and the patient's anxiety does not come back down to zero after the session's over. That's perfectly okay. We know from good research that just by approaching and confronting the feared reminder, that you're still making good therapeutic progress. And so there's also several rules that I've developed in working with patients that help us to do ethical and effective exposure therapy. I've already mentioned one of those rules. The first rule is that individuals, our patients, must give their consent. Exposures are never forced on a patient. But if the patient does give consent, we as the therapist will attempt to join that exposure as much as would be helpful. So if the patient's listening to loud cars and loud noises, we're also sitting with them there in the moment, listening to loud noises. And if the individual gives consent, then we will repeat those exposures again and again and again and again in the future. We are not going to do the exposures just one time. Very often we give the patient therapeutic homework. So we listen to loud noises in our session. When you go home every day this week, please listen to 5 minutes of car noises or something similar that would help them make good progress outside of therapy between appointments. Exposures are often done gradually and slowly. We start with easier challenges and we increase the difficulty of the exposure over time. We're going to talk about this in a little bit when we talk about building a fear hierarchy. And also, a very important process in exposure therapy is what's known as overlearning. So that is doing exposures that are harder for the individual than they would otherwise need to do in their daily life. So what I mean by this, I'm afraid of heights, or at least I used to be afraid of heights. And so I engaged in exposure therapy for myself to get over this fear. So that might be standing on a stool. Then later you stand on a chair. Then you go to the 3rd floor of a building and look over the railing. Then you go to the 8th floor. Then you go to the top floor of the building. The most extreme way that you could challenge your fear of heights might be jumping out of an airplane. For myself, my overlearning challenge, the thing that I don't normally do, is going in a hot air balloon. And now that I've been in a balloon several thousand feet over the ground, my daily experience of going high up off the ground does not bother me as much. So if you think about training for a marathon, if you train to run 5 miles, you will easily be able to run 2 miles. Overlearning is doing a bit harder of a challenge so that your daily life is easier. So we had mentioned creating a fear hierarchy. A fear hierarchy is a structured way to help the clients move through their fears and begin to develop greater bravery. This is a 1 to 10 list of these challenges that the clients could do. You as the therapist are helping the client to build this in your sessions. I commonly do this in Microsoft Excel with my clients, and you'll look on the left, you'll see it's listed from 1 to 10. A reminder that 1 are things that are annoying but not too difficult, all the way up to a 10 being the hardest, most difficult challenges. And in this example that I'm building a hierarchy for, let's say that a person experienced a school shooting where somebody came into their school and shot several of their classmates and caused a lot of damage before the shooter ended their life. So this person has survived a school shooting, and now they're in therapy with you, trying to move past their stress response that they experience when they encounter reminders. Very often when I work with patients, I encourage them to start at the top of the hierarchy and at the bottom of the hierarchy. Most people know the most difficult challenges for them or the easiest challenges, and then you fill into the middle. So for this example, the person perhaps would say that going back to the school where the shooting happened is the most difficult challenge. A 1 would be just on a whiteboard or on a chalkboard writing the words gun, shooting, violence. And then you add to this. So other examples could be writing a story, doing narrative exposure. So writing out 2 sentences, then writing a paragraph out, then writing and reading the full story about the events of that day. I give you other examples here that the patient might come up with, like holding a fake toy gun or looking at photos of the person that did the school shooting, or maybe a much harder challenge would be going to the memorial or the grave of a friend that died on the day of that shooting. And this is what you do. You give good psychoeducation to the patient on what exposure therapy is. You discuss the rules with them for how to do exposure therapy in a safe, ethical, and effective way. you construct a hierarchy, and then you begin to do these challenges over the course of therapy into the future. And that is the first video about how to do exposure therapy. Again, my name is Greg Muller. I'm very happy I could share this information with you, and you can find more information like this at my website.